Hello everyone. My name is Gail Clayton, and I'm with Beyond Pharmaceuticals. And I'm going to do a case presentation on pathway to optimal health using the organics acid test, urine test by Genova Diagnostics. Please take a brief moment to read the disclaimer. This video is for information purposes only and not to be used to diagnose and treat yourself by anything in this video or anything I have recommended to this particular patient. Okay, so the patient I'm going to talk about is a 67-year-old female. Her chief complaints is of fibromyalgia, chronic fatigue. She has daily migraines due to histamine dysregulation, mast cell activation disorder, and she also complains of digestion issues. Her medication is desloratadine, which is a non-sedating antihistamine. She says she takes that every day. Temazepam is a benzodiazepine used for insomnia, restless sleep. Trimethoprim hydrochlorothiazide is a diuretic that she is taking for blood pressure control, and then the potassium chloride is to counteract the side effects of trimethoprim because it causes potassium loss. Escitalopram is an SSRI. It's a selective serotonin reuptake inhibitor that she takes for depression, and bupropion is another antidepressant. Her diets and supplements. She reports improvements taking a supplement called D-aosin for the histamine intolerance. She takes that with meals, and it helps her not release so much histamine from digestion. She follows a low histamine diet, somewhat low histamine. She pretty much just avoids foods that she knows that triggers a histamine release. And she started taking Immunothrive about a year ago, and she said this was really a turning point. Before she started working with me, I had met her on a Facebook and recommended that she take the Immunothrive because she was having daily migraines, really bad fatigue, and she continued to go downhill. And within a few days, she just really felt like she was coming back to life after taking the Immunothrive. And then she was also treating herself. She wasn't working with a practitioner. And here's a list of the herbs and supplements she was taking: CoQ10, acetylcarnitine, quercetin, milk thistle, holy basil, methylcobalamin, omega-3s, magnesium, butterbear with feverfew. She said that helped with migraines, multivitamin, and some combination products called Vessel Care by Metagenics. She's also taking calcium malic and vitamin C and something called Fibroplex, which is another multi-formula product. I like using the Organics by Genova Diagnostics to help identify the focal point of a problem, especially when they can't afford the NutriVal. If the NutriVal is not covered by their insurance, then many times I will recommend starting with the organics. It's a lot less expensive, and if you have to pay out of pocket, a lot of times I can start here, and we don't have to come up with so much money right up front with the NutriVal. Okay, let's talk about how Genova reports their findings. And what they have is this quintile reporting system. Basically, everybody that's had a test through Genova is on this graph, and it's divided in quintiles. So the second, third, and fourth quintile basically represents about 60% of the population is going to fall in the second, third, and fourth. So what we're going to look at is ranges on your or this particular patient's organic test that's way out of the norm. And then on the right-hand side of the page, you'll see this 95% reference interval, and underneath it, there's like some numbers, some ranges. And what this means is that 95% of the population's test results are going to fall within this range. So I'm really alerted when something is out of that 95% reference interval. Okay, so I took some separate screenshots of the different sections in her organic acid test. This first section with the adiptic, superate, and ethyl malonate tells me a lot of information about the efficiency of the mitochondria. Her pattern indicates a low ATP production due to the lack of either carnitine and or B2. So what happens is, the mitochondria has an dual outer membrane. And carnitine will grab a hold of these shorter chain fatty acids. If they're less than 12 carbons long, then they'll go to the mitochondria for processing to make ATP. But it needs carnitine, and carnitine acts as a shuttle to bring it to the inside of the first membrane. And then B2 attaches to it to bring it to the inner membrane, where it then goes and gets chopped up into two amino acid or 2 carbon lengths, which then gets attached to CoA to make acetyl-CoA, and that's the first molecule that enters the Krebs cycle for processing energy. And when you have a shortage of either carnitine or B2, these intermediates then go to a place called the peroxysomes, where normally the long-chain fatty acids are processed, but ATP is not produced here. What happens is, the peroxysomes only has a single membrane, so then these intermediates will spill out into the urine, and that's a really good marker letting us know that that we're not making enough ATP, that we could actually make more if we had more carnitine or B2, and we have to figure out which one we're deficient, or if we're deficient both of them. Okay, so when I in seeing high levels of adipate and superate or ethyl malonate, I'm going to look at the pyruvate dehydrogenase complex, because that's right at the very top, where the Krebs cycle is going to be beginning. And I'm also going to look at the pyruvate lactate for this in this area too. So the pattern in this patient, where she has a high lactate, it means that there's a deficiency of one of the B complex vitamins. And for her, and later on you'll see how, why I'm a little suspicious of a B3 deficiency for her. So some of the things that I look at when I see that we have problems in this section is in that pyruvate dehydrogenase, is I'm going to look for some genetic mutations. There's a whole cluster of enzymes that work to make this acetyl-CoA. And if you have mutations in some of those enzymes, it's going to show up as problems with patterns here. But with this particular patient, I didn't see any significant mutations in the enzymes involved in the metabolism of pyruvate or lactate or ethyl malonate or adipate and superate. So I didn't feel like this was really a contributing factor for her abnormalities. And then I looked, kind of advanced a little bit to the alpha keto acids in the vitamin section, because they're also dependent on B complex vitamins to see, and her alpha keto acids were normal. So that kind of helps me narrow down what the problem was here. And so she has HMG, which is HMG-CoA reductase, and it's in the normal range, but it's in the 4th quintile, leading me to a little conclusion that she probably has a little higher need for B3, since B3 is a cofactor in HMG, and HMG is the rate limiting step for synthesizing CoQ10 and cholesterol. And of course, cholesterol is the backbone for all your hormones. So you're essentially, if you're missing niacin or B3, it can affect your hormonal pathway as well. Now, she has low sulfur, which is later on and further down in her OAT test, which is contributing to a cysteine deficiency, as noted by high cisaconate due to she has a high glutathione demand, and that's also B3 dependent. Okay, so the intermediates of the Krebs cycle. It's notable for high cisaconate and undetectable fumarate. Now, her cisaconate is cysteine dependent, and I believe that because her sulfur is low in the following section, that it's an indication that her glutathione demand is high, and she's using up the cysteine to make more glutathione, and cysteine is also a cofactor for cisaconate. And then another thing that gave me a little clue that there's some problems here is the fumarate. It's undetectable. Now the intermediates of the citric acid cycle can be pulled away if the precursors to make them are needed in other areas for protein synthesis. And the precursor for fumarate is tyrosine and phenylalanine, and your body can synthesize fumarate. And so what's happening is that the cycle is not refilling fast enough to keep up with the demand. And so I'm suspecting problems with some of the amino acids that are needed for synthesis for neurotransmitters, because this fumarate is undetectable levels, and that's going to mess with the neurotransmitter balance. Okay, so here's the section of the B complex markers and methylation cofactors. These are all the B vitamins. This section doesn't really detect a problem with any of the B vitamins as being deficient. And lipoic acid, folate, all of those are considered B vitamins too. Now, this isn't going to show a niacin or B3 deficiency, but for me, I kind of have a feeling that B3 has a different affinity depending on how important it is for that particular enzyme in the survival of the species. So the more important a reaction is for our survival, then the higher affinity. So apparently B3 is more important in this in the processing of these amino acids than it is in the citric acid cycle, because we make a whole bunch of energy, and pulling away B3 from one area because it's needed more in another area would not be uncommon. Okay, so the neurotransmitter markers. She doesn't have any COMT mutations, so we ruled out problems with that. It's notable for higher HVA, that's the homovanillate, but I believe it's because she's taking quercetin. Quercetin can cause higher HVA in the urine. And it's notable for higher, the 5-hydroxyindoleacetate, acetate. That's the metabolite for serotonin. And if you're taking SSRIs, it can increase the 5-HIAA levels in the urine. But basically, her pattern here, her overall pattern of the vandillamylate, homovanillate, and 5-hydroxyindole acetate is one of somebody under a lot of stress, similar to what you would see in a high-functioning executive. So the next section is the detox markers and detoxicants. That 2-methylhippurate is high. I see this a lot. We have a very toxic environment. We live in houses where there's outgassing of paint, carpet, furniture, all kind of chemicals in our surrounding. That's why it's really important to just keep the chemicals in your house at a minimum. Be careful when using. Make sure you use safe personal care products. Just decrease your toxic load as much as you can. There's no escaping it, but we can make a significant difference just by awareness. The glucarate is high, indicating an overall excessive load on the detox pathways in the liver. And this low sulfate. Now, this pattern here is telling me that she has depleted her precursor for cysteine for making glutathione. So she has a higher glutathione demand, and she's running really low on the precursors and making it. She's actually, not depleted of glutathione yet, but with the sulfur getting lower and lower, she's kind of at risk for being glutathione deficient and not being able to have the antioxidant protection that it provides. Okay, and on the last section is the metabolites of bacteria dysbiosis. she's really lucky. This section is usually really messed up with a lot of people with dysbiosis, high bacterial and yeast, and she didn't really have any significant markers for dysbiosis here. So I believe that the focal point of her health issues is niacin deficiency. Most likely, this patient has some amino acid imbalances that's causing an imbalanced uptake of amino acids for neurotransmitter production, leaving very little tryptophan available in the periphery to make niacin. We don't actually make niacin in the brain, so if there's an imbalance of the amino acids that compete with tryptophan for the brain, then tryptophan is going to go to the brain preferentially, and there'll be less in the periphery to make niacin, and the brain lacks the enzyme that will convert niacin, tryptophan to niacin. Some other recommendations that I made for this patient based on this OAT test was some vitamin B5 to support her detox pathways, some digestive enzymes. We put her on NAC to support glutathione production. And since I was suspecting some amino acid deficiencies, I went ahead and put her just on a overall balance-free aminos while we waited for results of her blood spot amino acid test that I had ordered for her. Even though we don't really know what the amino acid balance is, by providing a balanced free aminos, we can pretty much help any deficiencies that there might be there. Okay, so what could this patient expect with the B3 supplementation, detox, glutathione production, fatty acid synthesis and metabolism, citric acid cycle to produce ATP, cholesterol synthesis, hormone synthesis. And one of the things I thought was really important here for her to be on niacin is to help recycle dihydrobiopterin, which is BH2, back to tetrahydrobiopterin, BH4, to lower the oxidative stress, support her 1298 SNP and her GCH1, which is the rate-limiting enzyme for synthesizing biopterin. And that's resulting in the increased BH4 from ammonia removal. Now, subclinical pellagra, I see it a lot. It's a very common. Missed deficiency, and what it presents like is anxiety, palpitations, insomnia, hypersensitivity, agitation, fatigue, depression, and increased pain sensation. And I see it diagnosed as chronic fatigue and fibromyalgia a lot. And actually, it's a subclinical pellagra. Pellagra is known for it's called the 4 Ds: dermatitis, diarrhea, dementia, and death in very severe cases. Okay, so when my patient started on my recommendations and our follow-up, she said that her depression was resolved. She had decreased sensitivities from histamine, decreased migraine headaches, less pain, less anxiety, more focused, and she was able to decrease her prescription medication of the desloratadine. She was no longer taking it every day. She was probably taking it about every 3 times a week, she said. The temazepam was able to reduce by half, and the diuretic, she was only having to take half of her previous dose. And then she discontinued the Butterbur with fever flu because she no longer had severe migraines. She discontinued the Metagenics, vitamin C combo, quercetin, and the tart cherry. And she made this statement, my husband is so impressed in the improvements in my health that he's considering doing the organics test as well. Okay, so we got back the results from her blood spot amino acid test, and it was, in fact, significant for low phenylalanine and an unbalanced amino acid that competes for the brain transporter. And you can see here phenylalanine was in the 1st quintile, and then the tryptophan was in the 4th quintile, and these top 3 amino acids compete with some other amino acids for the same transporter in the brain. And so then another section where her amino acids were out of balance was this urea cycle. Now, this pattern that she has here with the high citrulline, ornithine, and arginine, it's a marker for nitrogen overload in the urea cycle. Now, she has a couple of heterosnips in the arginosuccinate enzyme, which could be contributed to a lower enzyme activity, given her difficulty processing nitrogen from protein metabolism, which can cause ammonia buildup. And then, of course, this last marker on this page, which it has tryptophan/LNAA, that's a ratio of the tryptophan versus the other amino acids, which is means it's the large neutral amino acids that compete for the same transporter for the brain. So that was my suspicions earlier that tryptophan was going to the brain preferentially, and in fact it was from this amino acid test. Okay, so from her blood spot test, I made the recommendations to continue her enzymes, niacin and B5. At this point, I think she ended up tolerating 50 milligrams of niacin twice a day. Is what she ended up being able to tolerate without having to flush. I told her to follow the Mediterranean diet because it's lower in protein and it's higher in omega-3, and omega-3 is very anti-inflammatory, and it's really good for people that have histamine issues at helping stabilize the histamine. We added some to her free aminos formula. We added some phenylalanine and branched chain amino acids in a custom blend to help normalize the balance, and so that we could have a balanced uptake of the precursors to make her neurotransmitters. And the results from these recommendations, she reported to me, she said, I'm doing really well as long as I continue following your recommendations. I can tell when I fudge on my diet and have and eat poorly, or when I'm under a lot of stress. But I no longer have chronic pain, and the migraines have disappeared. And she's very happy. So if you can't afford the NutriVal, I recommend the OAT test. I've worked with this patient over probably about a 4 to 5 month period, and identifying the focal point and starting there, and then working on the next thing to get her to where she's at a really good state. And with our last appointment, we settled on what she needed for continued health and longevity. And so finding the focal point of your health issues is really important, because you can really achieve optimal health and feel really good and wake up feeling rested and restored. So that's all I have, and I thank you for joining my video. If you have any questions, you can send questions to beyondpharmaceuticals.com.